News Now at 6.
First at 6, 845 cases tied the highest single-day number of COVID infections in Hawaii. The state also says 4 more people died, 2 men on Maui and 2 men on Oahu. Late this afternoon, Kauai County independently reported 1 new death, a man in his 80s. The positivity rate is now 7.8%. Hawaii's hospitals are overwhelmed. Today, Queens West Oahu Medical Center declared an internal emergency, saying it can no longer take any patients because they're out of beds. Ambulances are being diverted. Some hospitals are delaying non-emergency surgeries as bed space is maxed out due to the COVID surge. While the delays may not be long, for patients, it can be scary.
It can work its way right now to other parts of my body.
45-year-old Serena Erstad was diagnosed with breast cancer after a routine mammogram in April.
We do not know the stage of the breast cancer until the tumor is actually taken out.
Her mastectomy was scheduled next week at the Queens Medical Center at Punch Bowl. But this past Wednesday, she says she was notified the surgery was canceled. She was told it may be rescheduled in October and that chemotherapy was an option.
You know, you want to start your treatment and get rid of the cancer as soon as possible. So now knowing that my surgery is canceled is devastating, and it's extremely stressful.
She's trying to find another hospital for the surgery. Scott Werney has Parkinson's disease and says it's been getting harder to surf lately. He was scheduled to have a brain procedure to help relieve his tremors this past Monday at Queens Punch Bowl, but the day before was told it was postponed because the hospital needed bed space.
I was kind of upset that it had gone this far. I've been wanting to get this surgery, and now it's on hold, and I don't know how long. I've been told that it's indefinitely.
It's tough to hear that patients are being told that they've got to wait for some really important surgeries like mastectomies or heart valve replacements, or say hip surgeries that are also can relieve a lot of pain.
Queens Health System said in part, "We are rescheduling non-emergent surgeries as resources are pulled into providing care in other areas." Queens continues to accept patients who need emergency care. Dr. O'Carroll calls the current pandemic restrictions to bring down the hospitalizations not enough.
Just increasing the amount of sick is our solution.
While the patients we talk to have this message.
I would urge people to get their vaccinations.
If you're able to get vaccinated, I strongly urge people to get vaccinated.